Broadcasting from the business capital of the world, this is the Podcast Business News Network.
Welcome back to the show. We are so excited to have Barbara Greene here joining us today, our certified orofacial myofunctional therapist. And she joins us today here from Ventura, California, and she's helping so many virtually all over the world with her work. So first and foremost, welcome to the show. How are you?
I am very well, thank you.
Well, we are excited to have you here, and I would love for you to just start off by introducing yourself to everyone.
Well, I've been doing myofunctional therapy for 53 years, and I fell into it literally. I was working with a dentist, and we had a patient who was having orthodontic issues.
Okay.
So we sent her to a friend of ours who was a well-known orthodontist in La Jolla, California.
Yeah.
And he said, somebody's got to get rid of this tongue thrust.
Yeah.
And my dentist, who even taught at UCLA, said, tongue what? And then he took a one-day introductory course about myofunctional therapy and said, oh my gosh, this is what we need. So at that time, I was in the throes of severe TMJ dysfunction and in terrible pain 24/7. And they were rebuilding my mouth to try to get rid of the TMJ problems. Well, so I go back to the Institute of Myofunctional Therapy in Coral Gables, Florida, to study with Daniel Garliner. And he was a speech pathologist and myofunctional therapist.
Okay.
And I'm sitting there, and as he's teaching, and he's talking about people who breathe through their mouth, that is not acceptable and not normal. Oh. And I'm sitting there going, well, that's what I do.
Yeah.
And then he's talking about where your tongue should be at rest in the top of the mouth and not in the bottom of your mouth. And that's where mine was. And over the period of the 5 days that I was there, I couldn't believe that I was exactly the person he was talking about. So when I came back to help this young girl, she and I did the whole program together. So it's a weekly program where you do exercises twice a day at home in a sequential manner. So week by week, we build on retraining the muscles of the mouth and face. And we work on head and neck posture, head, neck, and body posture. We work on teaching them how to eat and drink correctly. We teach them how to sleep correctly.
Wow.
Because almost all the patients that I see have sleep apnea. And sleep apnea is a huge issue in this day and age. And unfortunately, most of the people who are being treated for sleep apnea are not being treated for myofunctional therapy to retrain their muscles on how to work correctly. And so we teach them where to have their tongue at rest.
Okay.
We teach them how to swallow correctly. We teach them to stop mouth breathing and breathe through their nose. And we also get rid of habits such as thumb sucking, finger sucking, nail biting, leaning, and we have a whole new problem in this day and age with the whole digital problem, with everybody with their cell phones with their head down.
Yes. Yeah, the neck.
And then you have iPads and computers and video games. And just yesterday, we were at Ventura Harbor enjoying the sights of the boats and everything. And every other person you see has horrible posture. So it's so easy.
My kids, they're 7 and 9. Last summer, my 9-year-old, well, he was 8, but I had to take him to the doctor because neck pain. Turns out because he's on the tablet so much like this all summer.
Exactly. So you have to, in an instance like that, there's a very simple exercise you can help him with. And you just take a pole from like the handle of a mop.
I have a mop. Yep.
And you put it across the middle of the shoulder blades, not the shoulders, but the shoulder blades. And then their hands come up on the outside of the pole to steady the pole. Okay. And with their head up straight, they can't bend forward now. And they walk 1 minute that way. Then they twist, they stationary feet, and they twist with their hips for 1 minute.
Okay.
And then they sit in a chair
Oh,
with good posture with the pole for 1 minute.
oh,
It really does help. It's only one of the exercises that I use, but it's something that everybody can do.
wow.
And if you have them do that 2 or 3 times a day, they start to be able to memorize in their subconscious mind what it feels like to have good posture. So that's one of the big issues that we have right now is the head, neck, body posture, because you have to remember where your tongue is. It's in the bottom. It starts here and goes down into your neck. So wherever your head is, it's influencing your tongue posture, as well as, of course, your head and neck and shoulder posture. So I see patients every day who have
Mm-hmm.
pain and shoulder pain all the time, headaches, or one side of their face or head is different than the other. And I can almost tell what side people sleep on or if they're stomach sleepers.
Wow.
Their eyes don't match and their sides of their face are different because they're always putting pressure. And then they sleep like this, which is a no-no, or even under the pillow, it's still a no-no, or arms up, and that's a no-no. So when you've got all of this pressure on your face, the whole time that you're sleeping, you can really tell what position a person sleeps in. So that's quite interesting. And can I share screen at all?
Absolutely. I would love to have you share your screen.
Okay. Um,
Look
oh,
at you.
oh,
Beautiful. There's our Zoom link. So excited to have you. By the way, if you are just tuning in, tonguethrust.com, go to that website as we continue to speak to Barbara Greene. And we are ecstatic to have her here. And she's teaching us so much about myofunctional therapy, which she does again in person in the Santa Barbara, Ventura, Greater Los Angeles, Southern California area in person, but online. Of course, she's available globally. She's helping us with these exercises that really help stop oral and facial habits that can ruin our smile, change our appearance, and get away in our health. So get in the way of our health. So there's a lot to this, and we're excited to have her here. She's now on the live Zoom, sharing her screen. So tell us, where are we going now? Ooh, we get the
what's
whole history. I love this.
Well, it's interesting that there was an incredible speaker when we went to Italy for a conference, and he had been studying how did myofunctional therapy originate. And he found that as early as the 1400s, that they
Wow.
were trying to find a technique that would create a positive growth and development in infants as well as children. And of course, the whole thing of tongue tie came up. And so we form alliances when we work in this field. We work with chiropractors, cranial osteopaths, dental people, of course, and
Mm-hmm.
sacral, Feldenkrais, and
Okay.
sorts of different practitioners, because we have to embrace other people's work and form a functional teamwork. Now, this is the scope of practice of orofacial myology. We assist in the creation and restoration and maintenance
Yeah.
of normal and harmonious muscle environment.
Mm.
And we evaluate, treat, and habituate. That's the important thing, because this has to become that's how you function 24/7, this new way of functioning. And these are our goals: to create a lips together posture, a palatal rest tongue posture, a posterior tooth together swallow, a bilateral chewing and correct drinking, back sleeping, hands and objects away from the face, establish nasal breathing, develop a symmetrical muscle matrix, which are your masseter muscles, the temporalis muscles, and the pterygoid muscles that support your jaw
Okay.
joint and your bite, and correct dysfunctional habits. Now, this is what I really wanted to show,
Okay.
is what's the difference between a normal face, where you have a beautiful forehead, nose, lip, and chin alignment with nice features of cheeky,
Yeah.
and a person who is more of a mouth breather. Now,
Okay.
a mouth breather wouldn't necessarily exactly look like this, but I have many patients who do. But it's from sitting with their mouth open all the time. So now the pitch of their head and their nose is farther back, and the upper lip has now become shorter. The lower lip is fatter and fuller, and the whole chin and lower structure of the face is down and back. So we call it a retruded chin.
I have that.
Well,
See? Can you see it?
yes. Uh-huh. And a lot of it is because people were not treated correctly orthodontically also. But they also have a very flat, long face look because we call it the long face syndrome, because the muscles are being, with the retruded chin, the muscles of the face are being pulled downward. And at the same time, it's an inward push. So they almost always have a narrow arch form. Now, this is how you would look if I took a knife and cut you in half. So here's your nose and your throat. These are your lips, your teeth. Here's the palate, and this is your tongue. So this lined portion is your tongue. And the tongue actually goes way down into your neck. So where should it normally be? It should be on the ridge behind your upper front teeth, but not touching your teeth. So it's a little further back than touching your teeth, and all the way across the top of your mouth. And then your lips should be closed and your teeth should be separated. So your teeth should never be together at rest.
Okay.
That's called clenching or grinding your teeth. So in an incorrect, or especially, and this can be incorrect even if your mouth is closed, the tongue is not in the top of the mouth. It's further down in the mouth. And now it's pushing either against the upper front teeth or the lower front teeth, or just in between the teeth, like a patient I had this week. He sits constantly with his tongue totally between his teeth and his lips.
Mm-hmm.
Now, see, look at the top of the mouth. Look at the difference between here, arch form wise, and here. So this is a high, narrow palate. And so now you've cut off airway. Look at the difference between the opening in the nose and here. So they have trouble breathing through their nose because the top of the mouth is so high up into their nose. And then the other major thing that we work on is the swallow. So about twice a minute a day during the daytime and once a minute at night, we swallow.
Yep.
And when we swallow, our teeth should now come together.
Ah.
So that's when we should be biting. And our tongue remains across the top of the mouth. But look what happens correctly. The back of the tongue pulls back and touches the throat. And the soft palate and uvula have elevated to cut off the nose area. And then we swallow. But in an incorrect swallow, now the tongue has not gone back against the throat. It is going up, and sometimes that's not even happening. But now it's so far forward that the tip of the tongue is touching the teeth or between the teeth, and the middle of the tongue is dropped away from the palate. And then they're using their facial muscles. So a lot of times if you watch people swallow, they go like this. And they tighten all of the facial muscles. So
yeah.
Of myofunctional therapy is how we, choose, are you a patient who needs treatment or are you okay? And so these pictures are wonderful.
Yeah.
And then we even have to take into consideration their birth and injury history. This child was a twin, and she was on the bottom all the time. And then the mother had very long and hard labor. And they really should have been a C-section. But finally, she was born. And when they were born, they looked like totally different children. I mean,
Yeah.
we always do. But I
Yeah.
mean, his facial features were perfect and hers were not. And if you look at her eyes are different. The facial form is different. It's different on this side than this side.
Yeah.
And she's a mouth breather, and her teeth are very narrow and need help. So then, how were they fed? Were they breastfed correctly? If they had a tongue tie, frequently
Oh.
babies are not fed correctly, and then they have colic. And so if they have colic, they should always see a cranial osteopath because they can get rid of colic in 1 or 2 visits usually.
Yeah.
And so a lot of babies have colic for as long as 6 months or a year or more. And so determining their birth and injury history is very important. And that's where we have alliances, either like with a cranial osteopath, a chiropractor, a cranial sacral person, so that they can get the inside, the
Yeah.
bone structure and the body working more freely. When they have restriction inside their brain, inside their head, and in their like neck and back and their legs. I saw a little boy at the beach yesterday, terrible walking, and he needs some cranial work to help him
Yeah.
straighten out all of his limbs in his body. And so we can do so much just by learning their history
Mm-hmm.
and helping them. So now she's not a mouth breather, and now we're trying to develop her bite, and we're trying to help them. This is a child who was a perfect child. He was the cream of the crop. He was happy. He was great in school. He loved everybody. And when he was 5 years old, he ran out of the restaurant they were eating in, and a car pulled up just then. And he went over, they hit him over the hood, down and under the tire. And after that, he said they told him he had a concussion, but then he became this not so nice child. He was always angry. He was unhappy all the time. He started to do very poorly in school.
Oh my gosh.
And so he happened to be in my church, and I happened to hear about him. And so I convinced them, and he became a mouth breather, actually. He was not before then. And so that's why they brought him to me. They heard about my work. And I said, he needs cranial osteopathy first. And once they did cranial, look at him now. He's standing beautifully straight. His
Wow.
head are straight. And he became this perfect child again. And he was no longer a mouth breather. It was just that his bones were under such stress that his body had trouble functioning.
Wow,
So,
this is Seeing is Believing. And for those of you on the podcast, you got to check out the Zoomcast. Barbara Greene's here live joining us, tonguethrust.com. And Seeing is Believing, the difference in this child. Oh my goodness.
yeah. And of course, I didn't even end up having to treat him. But what's important is that we diagnose correctly, because he needed something other than my work. Even though he was a mouth breather, he exhibited the problems that I treat. But when I heard his history, I knew where we had to start. So it's pretty amazing. And here's a picture of birth trauma. This is a child who in the womb was totally in the wrong position. And this is given to me by a cranial osteopath. And so she worked with this baby for months, but finally was able to help get his head into a more proper placement and his body. So birth trauma is big. The other thing we have to make sure of is that they're not tongue-tied. This over here is a picture of a baby's tongue, how it should be if it's nursing correctly. The tip of the tongue is down and the back of the tongue is elevated. But if they have a tongue tie, this little muscle under the tongue is too tight. Then see how the sides of the tongue now are going up?
Yeah,
and
yeah, they're
the tongue is totally down instead of up. No wonder they can't nurse. Well, I sent this baby for a tongue tie surgery, and this is 1 day later.
oh
This is
my goodness.
before surgery. This is after surgery. And she was able to come home and nurse correctly. So it was very exciting. And a lot of pediatricians don't even look for tongue tie anymore. It's very sad because it's such a simple surgery and it makes all the difference in the world in their ability to be able to nurse correctly. Then we look for other habits like thumb sucking and finger sucking, and we help them to learn how to stop doing that. So we put them through a motivational type program to help them stop sucking. And I have the great honor to be so good at what I do that they usually stop in one day. And sometimes they are able to stop the night habit in 1 day, but then we work on the day habit for a few weeks and they stop that in usually a week or 2 weeks. So it's very exciting, but you have to stop that first.
Yeah.
Otherwise, you can't retrain their muscles because with the thumb in the mouth, it just continues to teach the tongue to work the wrong way. So here's a little boy who he said to me, I cannot stop. I've tried, we've done everything. I just cannot stop. And so I convinced him to give me a chance to see if we could. And this is before when he was a thumb sucker, and this is after we finished his treatment. So again, you can see changes in their facial form and their body posture. See how he's hyperextending his head in the first picture.
Mm-hmm.
That's just to get air.
Ah.
And so this is, our job is not to correct the bite, but you can see here before and after, his bite was more favorable after treatment than before. So this is before.
Definitely. Absolutely.
Yeah. So then their growth and development is better, even with the, sometimes they still need orthodontics, but they're in a much better place for their orthodontic treatment. And then we always have to look at airway. And this is a child that could not possibly breathe through the nose because of a deviated septum. So this is the inside of the nose. And this is a deviated septum. And then these are turbinates. And these are all grossly enlarged. And so this child needs surgery to straighten the septum and to trim the turbinates and make them smaller. So this is what it should look like inside the nose. And the airway, when they tip their head back, should be nice and open instead of almost closed down. So our etiology of airway restriction, we've kind of narrowed it down to dust, dairy, and dander. These are the three things that so many people end up being allergic to. But if they're a mouth breather, they're even more allergic because what we have in the nose are little hairs that filter the air. We have an enzyme that kills bacteria. And then these turbinates are actually long tubes and they filter they warm the air to our body temperature and moisten the air. So anyone who's a mouth breather, they're actually insulting their lungs because the air is cold, dry, has bacteria in it, and has dirt in it. But a person who's using their nose correctly, the air is the body temperature, it's filtered, it is moistened, and it doesn't have bacteria. So what I find with my patients is mothers think that it's normal. I ask them, how many colds do they get a year? Oh, not many, maybe 5 or 6. Well, they shouldn't get any, or maybe just one. And so after they've done therapy, it's easier for them to not be congested all the time. We are usually able to reduce the allergies dramatically because they're filtering air.
Yeah.
And so that's the
Wow.
excitement of the type of work that I do. And tell me how much longer we have, because I'm not keeping track of my time.
We only have 2 more minutes left, Barbara, but I hope we're going to have more shows, right?
Yes. So
Great.
we'll pick up here.
Yes.
I mean, we'll go past airway because we've already discussed that, but we'll pick up on the next part of what we would look for and how we would treat it. And so I'm very excited that even if one person is listening and I can help them, or other myofunctional therapists can help them. Like, I have a little boy on an island in Thailand right now, and he has been so awful to not be able to breathe. The poor kid has tried and tried and tried to breathe.
Yeah.
And so he has seen a couple of ENT doctors, and they said he was fine. And I said, no way is this child fine.
Yeah.
He had a CBCT scan done and properly diagnosed, and he had totally enlarged tonsils, completely blocking his airway. He had enlarged turbinates, and he had a deviated septum. So he's now breathing through his nose. So he had surgery just last week. And so now we'll get back to finishing up on his therapy. So I thank you so much for interviewing me.
I thank you so much. You are so detail oriented. This seeing is believing. And I have a 7 and 9-year-old. So I'm a lot of this. I'm like, wow, my son's teeth. And I know what he did compared to who drank the bottle longer. This is all fascinating. I have a niece who's 14. She still sucks her thumb at night in her sleep. Like, there's a lot to be said for this, and to see how it could be corrected and fixed. Barbara Greene, we appreciate you here. Tell us one more time how we can reach out to you. Thank you so much.
All right. So they can contact my website or call me at 805-452-4302.
Beautiful. And if you don't mind just stopping to share the screen 1 second, I'd appreciate it, so we can properly say goodbye.
All right. Thank you so much, everyone.
Thank you so much. And looking forward to the next time we get to connect. Thanks again. Bye-bye.
All right.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.